Hi guys, my name is Kazumi, and for my fourth speaking assignment, I do want to discuss a method that we do use in my workplace, and this method is called AIDET, A-I-D-E-T. It is also, just a refresher, I do work for a family practice in a clinic that is affiliated with Medical Center Hospital. We have yet to become hospital-based, but the AIDET method is more of a, not just clinical, but it is also very concentrated around the hospital base, which is Medical Center Hospital. It is very important to keep updating our skills with these because it provides patient satisfaction, patient quality, patient effectiveness. We do want patients to feel important to us, and the AIDET procedure does seem to provide that for the patients and also clinical staff. Our manager has monthly meetings with us regarding the AIDET procedure. We get validated at least every 3 months, maybe by her or actual AIDET sponsors. They do. I do believe that my manager is a credible source. She has gone to multiple meetings regarding just AIDET itself. Now, AIDET stands for Acknowledge, Inform, Duration, Explanation, and Thank you. To acknowledge a patient, one must acknowledge them, say, oh, hi, eye contact. Make the eye contact. How eye contact is important for this speech, eye contact is important for the individual in person, our patient. As far as inform goes, if they do have like a sore throat, we have to inform them you might need a chest x-ray. If your lungs do sound off, you might need we might get your throat checked out. If it has any blisters, we might get you started on some antibiotics, depending on the doctor's perspective. As far as duration goes, you do wanna, it is very important, and it's no, I probably can't emphasize this enough. Only y'all would understand that it is very important for the patient. The patient does care about how long they wait in the lobby, how long they wait in an exam room, and how long the doctor sees them for. Some doctors see patients for 5 minutes. Some see patients for 15 minutes. It completely varies. With duration comes explanation. You have to explain what's going on, what might go on, and to also going back into the inform. It's just a big old process. You can mix and match it everywhere, but AIDET is just key points. Like, make sure you touch up on all those points. Also, you have to explain, because you do have to provide them with that credible source. You have to provide them with that you have to make your evidence reliable. Say, hey, the doctor is busy right now. This is why it's going to take so long. And of course, as a clinical staff, as a clinical professional, the patient will believe them, take your word for it, and understand that there are, things that happen, and it's very important. I do want to further discuss this into our other speaking assignments, so I don't want to get too in depth with this. We do have our results, which are surveys. Surveys are done basically 30 a day. We do see a lot of patients, and they do determine how well our AIDET skills have been. We got to make sure we thank them. We got to make sure we're there for them. We make eye contact with them. We treat them like people. We don't just treat them like subjects. And it is very important. I do feel that our surveys are the most important thing to determine how well we utilize these skills, as well as, we got to provide them with critical thinking, where they have to analyze and evaluate our words, our message. They have to understand that they do matter. They do make a difference. We can't just tell somebody he's gonna be here soon, just wait, he's busy doing what? You don't have to necessarily get into topic. I don't want to go over this. AIDET is really, as simple as it sounds, it's very complex to explain, and I do feel that in our further speaking assignments, I will be able to transition more easily into how these specific key points are implemented upon our patients and upon our coworkers as well. It's very important. It's a very important topic, and it's it's just something that I would definitely get into, but I don't want to overdo this. So I really hope this has pointed some of the keys necessary for this speaking assignment. If not, I completely understand. um, I am trying. I honestly, I'm a little bit confused about this, but I think it'll get easier with the further discussing it and actually managing my time while I do have disorganizational skills. So I hope you enjoy this speech, and I hope to hear from my peers.